Hi, everyone, and welcome to Dementia Chats. This is a video platform where I facilitate a conversation with those living with dementia and give them a chance to kind of raise their voice because they really are the true experts in where we can learn the most. Today, we've decided to talk about dementia when it takes a backseat to other health issues. And a lot of times people don't realize when health issues come up and someone's dealing with dementia, maybe it has to be treated differently, or it still has to be taken into account, and sometimes it's forgotten about. And then also we're going to talk about hallucinations and delusions and how that can be not only confusing to the person who's having them, but to others around them in terms of understanding that. So before we start, we'll have everybody go around and introduce themselves. And Jennifer, if you wouldn't mind introducing yourself.
I'm Jennifer Bute. I used to be a doctor and was involved in medical education, and I've been diagnosed with young onset dementia since 2009. But I passionately believe that we can do things about it to slow down the progression, even if we can't cure it.
Wonderful. Thank you. And Karen.
Hey guys, I'm Karen, and I was diagnosed in 2014, initially with Alzheimer's. It's changed several times, but like Jennifer, I also live my life as best as I can, learning from people like us here and people like Lori. So I appreciate that. And I live in Corpus Christi, Texas.
Okay, thank you. Craig, you want to introduce yourself?
Hi, my name is Craig Hanke. I was diagnosed in 2014 with Lewy body dementia, which was Lewy body dementia with Parkinsonism symptoms. That was changed this last year to just mild cognitive impairment with Lewy body, not symptoms, Lewy body traits, I think they called it. But the Parkinson's they ruled out. And I, along with Lori here, I belong to Dementia Mentors, and I'm involved with Dementia Action Alliance also.
Great, thank you. Lonni?
Hi, I'm Lonni Schicker, and I was diagnosed with mild cognitive impairment in 14 and recently diagnosed with Lewy body dementia with Parkinsonism. And you'll notice that when I start to tremor, somehow my whole body starts to move to try to get the tremors in control. It's something it's doing on its own. I don't understand, but I do move around a lot. I am originally from St. Louis, Missouri, and I moved not quite 3 months ago to High Point, North Carolina. And I guess that's it.
Okay, thanks, Lonni. Christine?
Hi, everyone. I'm Christine Thelker. I live in Vernon, British Columbia, Canada. I was diagnosed in 2015, I'm going to say, with early onset vascular dementia.
Great, thank you. And True?
Full legal name is Truthful Loving Kindness. My symptoms started February 1999. They said it was probably from something else, and then decided it was probably dementia in 2012. Then it was then they said mild cognitive impairment in 2015. I'm involved with blogging, Dementia Mentors, some still in Dementia Action Alliance, and Dementia Chats.
Wonderful, thank you. Jennifer, I think I'm going to go to you first and have you talk a little bit about, hallucinations and delusions, how that affects you and how others look at you and perceive those things happening. And then also, if you want to mix in, some of those other health issues, I know that you've had those as well. So we can tackle them one at a time or mix together there.
Well, in the last kind of week or so, I've had quite a bit of things happening that have reminded me of how hallucinations, misperceptions, and misunderstandings can be all mixed up together and people don't understand the difference. For example, if I'm walking down the stairs and I see someone coming towards me and they don't get out of the way and I carry on walking, that's obviously a hallucination because they're not there, are they? Because that happens sometimes, and it can be quite, well, I like to make it amusing because hallucinations can be terrifying at times, but if they're logical, it's more difficult. If they're not logical, then it's easy, isn't it? You just laugh. So that's hallucinations, or talking to people who aren't there, and people come up to you and say, who on earth are you talking to? Misperceptions, well, I've moved to this new place and I was sitting in the restaurant and looked outside and I thought, oh, that's strange. There's a man out there, with a walking stick and a dog. And I looked again and he was still there, exactly the same position. And I thought, well, don't be so silly, girl. He couldn't possibly be in the same position after all that time. So I thought, well, what else could it be? And of course, it was a misperception. I was looking at something. It was a tree, in fact, that had recently been planted about, I don't know, between 4 and 5 feet. And there was a staple in the ground, a stick, to hold the tree up, which I thought was the walking stick. And in fact, the tree was long and thin and had a shape that could indeed be kind of a person with a funny hat and a person's head. So that was a misperception. And then the last thing that happened just a few days ago, my sister came to see me, and I've known her all my life. And as we walked down the corridor for her to go home, she suddenly said, oh, I've forgotten my phone. So I came back. I said, I'll go back and get it. So I picked up her phone and went out into the corridor, and I thought, who is that lady in the corridor? I've never seen anyone like that before. I don't know her. She's not a resident. She's not a member of staff. No idea who she is, but never mind. I won't take any notice of her. So I walked down the corridor carrying my sister's phone. And as I got to this lady that I had no idea who she was, she said, you're going to give me the phone then? And I said, no, certainly not. It's my sister's phone. I'm not going to give it to you. I'm looking for my sister to give it to her. And of course it was my sister, wasn't it? So that was a complete,
Yeah.
whatever. So I had all of those in the last kind of 10 days or so, didn't I? But they're all different, aren't they?
Yeah.
So whether you want someone else to talk on that subject.
Well, I have a question for you, and because I think that this is really relevant. How did your sister deal with that when you didn't recognize her? Because I think that's a big issue for a lot of people.
Yes, it is. And a lot of people, particularly their families, say it's the worst thing that could possibly happen if my mother or my father don't know who I am. Well, I don't think it's the worst thing. I was in hospital once in a medical ward, and my son, who lives in Ukraine, came over to visit me, and I wasn't expecting him. And after we'd been talking for a little while, I don't know, 5-10 minutes, he said, you're doing ever so well, Mum. You're treating me very nicely, but you haven't a clue who I am, have you? But he didn't care. And the same, when my husband was alive, he said, you'll never forget the look of horror I had on my face when he got into my car. Well, why wouldn't he? I was meant to be picking him up, but I didn't know who this strange man was. But my family know that it doesn't mean I don't love them. They know that I love them, and I know that they love me. So they know the best way of treating it for me is to laugh at me. Mm-hmm. And I don't mind that. So my sister, of course, just over, a week ago, she just laughed. She said, oh, you silly old. And of course, no person who didn't know me would dare say that to me, would they? Mm-hmm. So I thought, oh, you silly girl, it's your sister, isn't it, after all?
Well, I think using humor is good, though. You know, I think humor is such an important piece of relationships, and when we let that go, and again, knowing on a deeper level that the love is still there, and you know, wires are just crossed, and you know, the connection's just not made at that level, but it doesn't mean it's not made at all other levels. And I think people take that so personally. I know I saw that in my own family as well, and it's probably one of the number one things I hear from family members, you know, is how do you deal with that? And it's, you have to change your perception of what that means, you know, in your interpretation. True?
In, I think it was like 2015 or something, I sent out Valentines to the family members that I was close with. And I put, "You're important to me." And on the inside, I put, "If I appear to not be recognizing you, do this. Remind me of this. Start singing this." You know, whatever it is that most closely links my memories of that person, I put inside of the Valentine card.
That's smart. That's smart. Giving them cues, you know, to connect. I think that that's really, really powerful. Jennifer, I'm just going to go back to you for a second. Was there anything that you wanted to say about, you know, when you have other health issues on top of dementia? I know you've had a few yourself, in terms of, you know, even maybe going to the hospital. Did people recognize and really appreciate the fact that you had dementia, you know, when you went in for your surgery? And nope.
No, it was really difficult. The incident that I remember very clearly was being in the room waiting for my emergency surgery and seeing the clock that said 11 o'clock in the morning. And the next time I looked at it, it said 4 o'clock in the afternoon. And I was terrified, because 1 second it said 11 and the next second it said 4. And there was a nurse standing at the end of my bed. And she said, "What's the matter?" So I said, "It's 4 o'clock. She said, "Yes, of course it's 4 o'clock. I said, "No, it's not. It was 11 o'clock last time I looked." "No," she said, "it's 4 o'clock. So we had an argument, didn't we? And the more we argued, the worse I got, because I was terrified that something had happened to my life. I had no recollection that I was in hospital. I had no recollection that I had been paralyzed. I had no recollection I'd had an operation. Because of my dementia, you see, I had forgotten everything. So I was absolutely terrified. And all I got told in the end was I was told off, because I was being a nuisance, because I was so frightened and terrified. All she needed to have done was to have explained to me, wasn't it? But she obviously didn't understand that I had dementia and I needed help. Mm-hmm. So, you know, that was really tough. Yes. Mm.
Yeah, I interviewed a woman the other day talking about her husband, and he was going in for a medical procedure, and he has FTD with the behavioral variant, and he kind of went off on the doctor, and the doctor didn't take any of that into consideration at all, and was like, "Well, if you're going to be abusive, you're out of here." And the wife is like, "No, we need to calm him down. This isn't, you know, he's not trying to attack you. This is part of his disease." And she said it was so difficult to watch that process. And then when she got him all calmed down, the doctor kind of looked at her and couldn't believe how she did it and how simple it was to do, but just didn't have a clue. And we hear so much of that, I think, especially with hospitalizations, that, you know, people are getting their own discharge information, at which, you know, there really needs to be someone else there, or, you know, doing some of those processes and things. It can be downright dangerous in many situations. Craig, how about you? Do you want to talk about, you know, kind of the dementia taking the backside to other illnesses?
Sure. Before I do that, though, Jennifer reminded me, I'm I think it happens to most other dementia patients also. When winter is setting in and it's dark at 4 o'clock in the afternoon, I lose consciousness or track of if it's morning or night. And I want to go to bed at 4 o'clock in the afternoon, and my wife says it's only 4 in the afternoon, and I insist, no, it's 4 in the morning. I should be in bed already. That kind of stuff happens to me. Yeah, I just recently had toe surgeries on both feet. The left one as of late. And it's a good thing I had a caregiver here, and my wife, because I'm laying down, I have my foot up, I have ice on it. I have a 15-pound boot on my foot, and I just think I can get up and walk. I don't remember that I have this foot surgery. So luckily my wife was there to say, no, sit down, you need your wheelchair or your walker. At that time it was a wheelchair. I graduated to a walker, but yeah, you lose track of, you don't remember that you actually had the surgery. And it could be dangerous. If I was to put full weight on that foot, it would have completely messed up the whole surgery, and I'd have to have it done all over again. And then my buddy he's a good guy, but we were up at his cabin this last week, and we were talking and doing things, and I was trying to work with his phone, and he says, I don't think you have dementia. He says, I don't think you have it. You still have too much up here going on. And I disagree with him actually, because I've heard this many times before, and people say you don't look like you have dementia. And I usually have a comeback that's not very nice, but so then that night, my Lewy body dementia, which I think I have now, they said it was mild cognitive impairment. The Lewy body dementia came back full force. And I was yelling in my sleep. I was kicking and punching, scared the living daylights out of him. He's seen this before, but that morning he said, I take back what I said. I said, I think you do have this. I was like, well, yeah. And it's gotten worse now because of stressors. They took me out of my job because of stress. The stress of the job alone caused symptoms to be worse. The surgery that I had in my foot, my mom is not doing well. And because of those stressors, just those two alone, make my symptoms a lot worse. And then the next day he expected me, and I'm using a cane now still. The next day we were out, he took me out in his truck into the woods, and I'm walking around, hobbling around basically. He said, do you think you can handle this chainsaw while I go cut the grass? I was like, I said, Joe, no, I said, I'm not supposed to handle machinery at any type because I do stupid things. Like a snowblower, for instance, I put my hand down the chute to unclog it while it was running. I think it was 4 or 5 years ago. I was operating a skill saw, cutting boards, and something told me that I should reach out and grab that blade while it was running. It made no sense at all. My doctor said that kind of stuff happens with Lewy body, that it tells you to do things that you shouldn't be doing, basically. So I told him, no, I'm not handling a chainsaw. For one thing, I only have one good foot. I don't have balance. And he was disappointed that I couldn't help him with this project that we were supposed to be doing. But I just sat in the truck and I said, listen, I'm not helping you with any of this because I can't physically do it yet. And I can do damage to what was already fixed.
Good for you for making that decision. A lot of people would give into that peer pressure. Good for you.
And he's never done that before, so it was kind of weird. I think he I think he was that way because he's the one that I was talking about before we recorded that. He fell and broke both rotator cuffs and a meniscus in his knee. So he's has one shoulder fixed, but he's still got one bad knee, and he's out there trying to do chainsaw work and other things too, which he shouldn't have been doing. But he wanted to get it done because in 2 weeks he has the other shoulder done, and then he's out of commission for another 3 months, I think it is. But he usually never forces me or gives me peer pressure to do these kind of things. But for some reason this time he was, because I think he was on a timetable to get things done.
Might have been timetable, and he might have been feeling physically less than, and he might have been in pain, and he might have thought, well, you know, he was good before, and then it was at night he had his symptoms, so maybe he's okay this after. I mean, people think weird stuff, you know, because if it's not visible to them all the time, then you're your same old self. You know, why wouldn't you be, you know, in their eyes? So I think sometimes that just kind of confuses things for them too, when it isn't constant. You know, you're not at a same constant level of not being able to do. And I think care partners and friends, they want to hold on to seeing people with their abilities, you know, as a whole. And then you add on, he needed help, you know, with that.
And just, he has 2 big Labrador Retriever dogs that don't behave at all. They don't listen. Just the stress of having them around me, and the one ran right into my knee on the bad leg. Just the stress of having them around me was causing me to have symptoms too. The hallucinations that I was having 2 years ago started with this. If you know the movie Chucky, it's that Chucky doll, a little menacing doll. The whole room would fill with those dolls, and they would be telling me to do things, bad things. That stopped with the medications that they had me on, but now that sort of started again 2 weeks ago. Not with, they're still the same, but they're not as menacing as they were. And that's where, if other people are sleeping, they don't see that happening. So again, you don't have it because you don't see anything happening to you. But they can be quite terrifying, especially with the night terrors. You wake up in the middle of the night and you don't have any idea where you are because you're still sort of in this dream state, night terror state, as I call them, because they are night terrors. And it's a good thing that I have a caregiver that is in the room right next to me, and she can hear what's going on, and she come in right away, and she knows not to physically touch me and wake me up because I start swinging, because I used to be a correctional sergeant, and I used to fight with inmates once in a while. So she knows not to physically touch me. She'll give me a stick or my walker or my cane, I should say, and then poke me with it. But that's the illness is the other illness. I'm kind of out of track there, I'm sorry, but having other illnesses with dementia can be quite bad, because like I said, I didn't realize that I had this thing on my leg and I wasn't supposed to be walking on it, and I just thought I could get up and walk to the kitchen. So it's a good thing that I had a caregiver there to tell me that, no, you can't do that yet.
Yeah. Well, and I think you also pointed out that not everybody sees the need to maybe remind you of not being able to do that, or what your ability levels are. And, you know, like with the saw, that was great that you knew that. You knew not to do that, because I think it's, I mean, it's kind of full circle with this stuff in terms of awareness. So thank you.
And in fact, I do have one more thing. In fact,
sure.
I had a reminder. I showed him I have a hole in my jeans, and like the inner calf, that the circular saw that I was using, I pulled it away and actually caught my pant leg.
Oh,
And I said, and that's why I don't operate machinery anymore, because that could have hurt me very badly.
oh, yeah. Yeah. Thank you. True, I'm going to go to you because I know your internet could go on us anytime. So I'm going to pull you in and have you talk about, I don't know if you have hallucinations or delusions at all. And if so, if you want to talk about those.
Yeah, I have, not very often. I have hallucinations. They are less with Aricept than they are without. And mostly my hallucinations are sound and smell. Very seldom do I have sight. However, I have plenty of nocturnal hallucinations, but usually when I have sight hallucinations, there's some variety of bugs.
Okay.
And what was the rest of the question?
Oh, I wanted to know about hallucinations and delusions, if you had those, and how that affected you or others around you, if they understand them. And then the second kind of question we were talking about was if you have other health issues that kind of throw dementia to the back seat, where people aren't really incorporating your dementia, they're totally focused on something else.
I don't know. I mean, I've got plenty of other health issues. Blank. There was something I wanted to say, but I don't remember what it was.
Okay, well, if you think of it, we can always come back to you. Not a problem with that at all. So, Lonni, I'm going to go up to you since you are dealing with a medical issue and you've got your arm in a sling. And
Yep. Well, I'll tell you, I have had multiple medical issues over the last 2 years. I had a couple of strokes, and it's so funny that people would blame my periodic confusion with having the stroke. And so they would say, well, you're not confused, you had a stroke. And so it's like they weren't mutually inclusive. They couldn't say that. Even physicians would come in and say, nah, or, even when I go visit the doctor, I hate how they say, well, you seem too smart to have dementia. I'm like, wait a minute, that isn't even a thing. And physicians a lot of times don't get it. So when you become ill and you have any form of dementia, they tend to negate the dementia altogether. It's like not a concern for them. So with all of these health issues, it's been really difficult to have physicians be more accepting of the Lewy body. So in some ways, moving has been a real blessing because they're hearing it from the ground floor instead of something that happened during your journey with them. So it's kind of nice. And then the other thing is I have terrible hallucinations. I've only had 2 that have been terrifying and were definitely terrifying. One was when my bedroom was flooding and I couldn't get out. And then one of a man standing at my back door who literally walked into the house. And those 2 were terrifying. Other than that, they're usually pretty humorous. I was at a doctor's office, and it was a neurologist, and he asked me how my hallucinations were doing. And I said, is there a rabbit on your desk? And he said, no. And I said, there you go. It's still there. But, and in my family, I think kind of like Jennifer talked about, we kind of make fun of it. And, you know, and I do too. And I don't find it, in fact, I kind of like when my hallucinations, or if I get really forgetful, I kind of like that, like my son uses a lot of humor, because I can laugh about it and then just move on. You know, we don't dwell on it as a bad thing. You know, mom's seeing things or mom's forgetting things. It's funny. And in our house. So, and you know, we actually talk about dementia. We understand, Dan and I have been on many committees together. I worked with the Alzheimer's Association for years. And so we understand what a serious thing it is. But at the same time, if you can meet it with some humor, it makes it not so tense, because the worst thing is when everybody's sitting around waiting for the other shoe to drop and, you know, waiting for you to become completely forgetful. And I've seen that in a lot of families. And it's awful, because they're always like, even when I talk to my friends and they're talking about their parents' dementia, and, you know, they'll cry and it's so negative and they're constantly waiting for things to get worse, where we just kind of live wherever I am, you know, at that level. And, you know, we laugh a lot about it. I forget things all the time. My son's always like, he has something in his hand and he's going, were you going to need this? And I'm like, oh yeah. So, you know, definitely more forgetful, but we meet it head on. And I think that that's very helpful. One other thing I was going to say about dementia taking a back seat. When I was in my doctor, the last visit that I had in St. Louis was with my primary, who was a wonderful, wonderful woman and totally would address the Lewy body every time I met with her. I was telling her that I went to see a new neurologist, and the new neurologist said, well, you have a doctorate. It can't be possible that you are as confused as you think you are. And I said, you know, there's no correlation currently that they can find between education and dementia. And she said, and this was the neurologist, and she said, it certainly feels like there isn't much wrong with you. I'm like, you're the neurologist. Of all people, you should understand. But no. So when I talked to my primary, I was telling her that, and she said, sometimes I think that doctors who understand the disease need to go out and speak to the people who should understand the disease, because she said that's so frustrating. And it, you know, it is, it's incredibly frustrating to have to justify your disease to a physician who should understand it.
Well, especially when they're a specialist in
Exactly.
that area. And, you know, it just confuses everything too, because then you start, I would imagine, questioning yourself. The family does. I mean, when they're hearing that from professionals as well. I mean,
well, and for a neurologist to say you're too smart and you're too articulate.
Mm-hmm.
And I said, I know a lot of people who have really severe, like full-blown symptoms, who are still extremely articulate
Mm-hmm.
and who have higher education. So it doesn't have any, they're not mutually exclusive. You don't have to look at them separately. You can have both at the same time.
Yep. Yeah.
So it's very frustrating. And I know True wants to get back on.
Okay. Thank you.
Before she loses her internet.
I didn't catch what you said. I have terrible time understanding people, but I heard my name. So, and I heard articulate. That is something that I have had more than one neurologist say, you are too articulate to have dementia. And that's pretty bad from specialists. But another point I wanted to bring in was, yes, we say a lot and we use humor to kind of normalize the atmosphere and bring everybody, it's okay, it's, you know, but it can, so many people don't know how to do that in a healthy way. And it can end up like they are minimizing what is happening to me, or they're making fun of me. I think that it might be a good idea to go really careful on the humor until the person that is experiencing the symptoms brings in humor. And then it's much more likely to go in positive ways. Also, oh, okay, what I wrote. And for me, it is most scary when I don't remember that I've got cognitive disabilities or hallucinations, because then I don't think of using strategies, because there's no need to use strategies when I don't remember I've got the problem. And that has created greater problems probably than anything else.
Oh, yeah, because then it's totally, totally real. Go ahead, Craig.
With a therapist, and over a year ago, she said, because I'll wake up from these night terrors and I have to leave the room, go to a different room and do something completely different, because if I go right back to sleep, these night terrors continue. And one of the coping strategies that she was working with me on was to change the outcome of the night terror into something positive. And it worked, and it was working, but like Chu said, I forgot that I had that strategy. So it just snowballed into the full-blown night terrors again. And then I wanted to ask Lonni, when you said that you had, was it a hallucination or a dream where you said that you were trapped in the room with the water with flooding?
No, it was a complete hallucination. I was watching TV and I looked down, and you know those little Solo cups, the red ones that people drink like beer in at parties. So all of a sudden I saw like thousands of them in my room, and they were all filling with water. And they started to all run over, and I could literally feel the water on my feet. And so I picked up my dog. I did this literally, picked up my dog, and I was heading down the steps. I was upstairs and tripped. And honestly, if I hadn't tripped, I probably would have fallen down the steps, because there was a gate in front of the steps for my dog. And so I would have gotten probably very injured, but it kind of snapped me out of it. I turned around and looked, and the cups were still there and they were empty. And then all of a sudden the cups were gone. But yeah, I was wide awake.
And the reason I asked that is because most of my night terrors are that I'm either trapped in a building that I can't get out of, or trapped in machinery that I can't get out of, and I get crushed by it.
Oh my gosh.
So my neurologist is working on that to find out why it's always the situation that I'm trapped.
Yeah,
or,
that's terrifying.
Yeah.
Oh my goodness. Yeah, that's terrible, Craig. Most of mine are fairly friendly, like somebody's just sitting at the desk with me or at the table with me. And I don't even try to talk to them. I just know they're there. Once I was in a casino and I felt a presence constantly. Everywhere I would move, everywhere I would go, I felt this presence, and would turn around and nothing or nobody there. And so now that has become more frequent that happens. It's more of a feeling. But it drives me crazy, because I have to always, even though I know there's no one there, I have to keep turning to make sure. So it kind of drives me crazy. But I had almost a bad car accident. It could have been really bad because of hallucination. I thought there was a family of deer standing in the middle of the road, and I went off into the median. and then saw all the other cars just driving straight through and realized that there couldn't have been a family of deer standing there or somebody would have hit them. Yeah, so, but yeah, they're definitely, you know, like yours, so real at the time that it does make your heart race, and you're, you know, you just feel like there's something crazy. Some of my friends have very funny hallucinations. Mine aren't that funny, but by the time my son gets done with them, they're definitely funny, because he usually talks me down.
Okay, well, thank you. Karen, I'm going to go up to you and see if there's anything that you wanted to add regarding, you know, dementia when you get another illness or when you're dealing with something else, if that kind of takes over and people kind of forget that you have dementia.
Yeah, really all of my catastrophes, my gastric bypass, both knee replacements, the shoulder replacements, was all pre-dementia. So I've got those handled really well. And this latest thing that I have is a renal cell carcinoma. And it happened a couple of years ago, and there's no chemotherapy or anything. You go in and you get your MRI, and mine's wrapped around that vein. So if it grows any, I have to get the kidney removed, which won't be in my case. And so I go in every 6 months, and last week I went in, and he looked at me and he says, man, you know, they had a hard time finding that tumor. And I'm like, oh, that's good. That's very, very good. So I still have to get it checked, but I haven't had that affect my dementia. What is affecting my dementia? We talked about, and I'm not good, you know, verbalizing, but the family system. You know, when I first got diagnosed, my family was like, we're all partiers. And what I learned also from True and everyone else is what would help me be a part of my family. So, okay, well, my issues right now, because when you've met one person with dementia, you've only met one person with dementia. So my issues, I don't have hallucinations or delusions and stuff. I have communication problems. Talk a little slower, you know, give me just a chance to comprehend and then respond, that kind of a thing. Little simple things. Now, am I going to have to repeat that again? Yes, I will. So, but the fact is that because of these groups, I have a voice, and it's just imperative if I want to be a part of society, whatever limitations or gifts that I have to speak for myself, and without getting an uproar. Real quick, the humor, I live on humor, but like True said, it's touchy. It's touchy. I'm in other 12-step groups, and well, I was the first one with you know what, and I was always kind of joking around and stuff, but they were just petrified of joking. And so I had to explain, it was my responsibility, because I'm okay with it. You know, hey, laugh at some of these stupid things I'm saying, or that kind of a thing, to where it was okay. But then I also reminded them, this is on me, you know, a person that doesn't have dementia. You know, I mean, that whole it's difficult to, you know, well, you're allowed to say this because you have it, and you're allowed not to because you don't, and is it going to hurt your feelings? And not, shut up, you know. My thoughts go obviously from, I've loved everything that everyone has said, and I had comments on each person, and yep, they're gone. Living in the moment is where I am, and that's really important for me to realize that I don't have to remember everything. The doctor's appointments, I used to take my phone in and I would have it recorded, and everything was really cool. Now, even though I have it recorded, when I hear the recording, I don't remember it. So I need it in writing. So now I'm going through we all know what I'm talking about. So there you, and my part of, I live alone, but I'm no longer able to, everything is auto pay, which is great. But if an insurance thing comes in, all the technical stuff I have a friend, my backup brain, Katie, and she helped me get my cremation done, and the legal stuff and all of that stuff that even though she's helping me, I still don't remember. It's getting done. So my responsibility is to ask. And that's where I am. Thanks.
Okay. Great. Well, this has been a really interesting conversation. I think it's going to help a lot of people understand dementia better, understand the complications of, hallucinations and delusions and misperceptions and miscommunications, as well as, what do you do and how do you really act and react and support someone who's living with dementia who also has some other health issues. It's really easy for us to focus and zone in on the new problem, but the old one still exists and it's going to impact. And, I think that that's just critical. And I'm not just talking to families here, I'm talking to professionals as well. That became very evident just in our conversations here. Everything, we really have to get people trained to look holistically at someone and what they're dealing with. What are their abilities? Where do they need support? How is communication going to be affected? And modifying and adapting to meet that need. I mean, I feel sorry, Creeky, for you and so many others. And I've seen this myself when dealing with my parents. It's up to the patient to figure out how to be able to get retainable, communication for yourself, and for the patient, a lot of times it's writing notes or you're doing the audio. And yet nowadays, they have somebody a lot of times sitting in the doctor's office typing everything up, but not everything gets passed on still to the client. And that's a critical piece. I don't know if they understand how much stress that in and of itself is, when you're trying to partake in a conversation and you're trying to remember the critical points. I mean, it's a lot when you're overwhelmed, even if you are full capacity, let alone if you're dealing with dementia, or another, critical health issue. I think that's another area that doctors need to be trained a little better in, if they really want good outcomes for the patient. Those details need to be communicated in the way that's going to serve the patient and their family the best, in the best format there. So I appreciate you all sharing. Is there anything else that anyone else wanted to say? I know Christine had to drop off and Craig has to leave for another meeting here. And I want to be respectful of that. Okay, well, if there's no other comments, to our audience, I hope you like, click, and share this. My saying is don't keep the nuggets to yourself, pass them along. There's a lot of other people that need this information. And again, in my mind, there's no better resource available to us than those living with dementia. So thank you so much, and we will talk soon. Bye now.